My name is Jenni Gabelsberg, and I am the founder of Women's Advantage Physical Therapy and the director of PT here.
Physical therapist.
I think kind of the best part of the job is the impact that we have on women and men's quality of life long term. That we have all these people coming in and they have been struggling with things like incontinence or prolapse or pain with penetration for so long that they've really lost confidence in themselves and kind of trust in their own bodies. And to be able to create that empowerment in them and get them back to doing the things that they missed, sometimes the things they thought they would never get back to, that's kind of the best present that the job gives every day.
Enjoy talking about.
I love the mamas. I love talking about birth prep, that we actually can birth in different positions other than just on our backs, that there are some techniques we can think about to help reduce risk to our pelvic floor during that pushing stage, and also that our postpartum mamas are such a neglected population that if we can empower them to start their exercises immediately after birth and start retraining all of those over-lengthened muscles that just truly have forgotten what they are supposed to be doing again, that makes a huge impact on their lifelong quality of life. Although I do still love pelvic pain and kind of any of those out-of-the-box type diagnoses as well.
What was apprehensive coming in?
You just gotta come for one visit. Once somebody comes in for their first evaluation and sits down with our therapist one-on-one for 45 minutes, the therapist really kind of peels the onion back and figures out all of the depth of the problem and the driver of the problem. And we talk about what our plan of care is to help resolve these problems that people may have had for 6 weeks or may have had for 16 years. I think they feel much more validated and heard and can understand the value of physical therapy. I mean, most people aren't ever told there's PT for your pelvic floor, right? There are not that many of us in the United States. And so if people aren't used to the fact that there is somebody who really works like chest to knees as our primary region, they may be really apprehensive about coming in.
That not many people know.
Well, I grew up as a competitive downhill snow skier. You know, my husband has one of those watches that times your speed, and I said, give me that. Because he was looking at it and he's like, oh, I hit 31 miles an hour. Like he thought he was just doing great. And I said, great, hand it over. I get to try this time. And I went down, fast and hit 55 miles an hour. And I thought, Mama still got it.
How did Women's Advantage come to be?
A few years in, we had a urologist approach the office and asked, did any of the therapists know how to treat urinary incontinence with biofeedback? No one else in the clinic, everyone refused to go to a course. And I thought, all right, let's go see what this is about. I know nothing about incontinence. And I go to the course and everyone there is under the age of 40 and half of them are there to learn how to treat themselves. And I thought, what is this? Like, why is this happening? I really thought incontinence was a nursing home problem. Like this is happening to people just walking around in the community. And, I think my passion was born there. And the more you learn about pelvic health, which is one of the really cool things about it, the more you realize you don't know. There is such depth and breadth of what we do that it is great to learn more and more every day. And knowing that I always wanted to open a practice, it just was kind of the perfect thing to be able to start renting space a couple days a week at the clinic where I was working and then continuing to work in orthopedics as well for a while.
What drives you and your purpose for this company?
I think, as we talked about a bit earlier, is the fact that so many people come in here and they have lost confidence in their bodies. They have lost trust in their bodies. They are limiting themselves in so many ways, whether it's exercising, whether it's going out for social events, whether it is in the intimacy with their partners, and our ability to impact that. And people telling us what great impact we've had on their quality of life really is what makes it worth coming in every day. It is being able to help people resolve bladder issues and bowel issues that keep them from leaving the house and keeping them from forming social relationships. I remember a patient that came in that was older, in her 60s, and she was coming to see me actually for bowel issues, but she had always had pain with penetration. And she said, I never got in a relationship because I never wanted to explain that to someone. And I was maddened by that, because if she had gotten to us 20 years earlier, then we would have been able to help resolve that problem. It wasn't this crazy, challenging problem. It was something we deal with every day. So patients like that we have such a massive impact on what the rest of their years look like is really such a present.
Pelvic PT.
Pelvic PT is not all Kegels. We look at a lot of the other systems in the body, obviously. I mean, our degrees now are as doctorates. It's not that we've had a 6-month course in something as well. So just the depth and breadth of what we do being much more expansive than what a lot of people understand. Yes, we need to learn how to strengthen our pelvic floor. We also need to learn how to strengthen all the other core muscles that help us balance pressure and what we call load transfer, and looking at postural alterations and looking at overactivity. Some of our patients aren't just weak and need strengthening. A lot of them are overactive and actually need to learn to lengthen or let go and relax first. We have much more depth and breadth of what we are looking at with our patients. We are evaluating a lot more than just the pelvic floor by itself. Although we love the pelvic floor, you know, it's my favorite muscle. But it doesn't stand alone in most cases. We need to really be looking up the chain and down the chain and figuring out what else is going on, because oftentimes the pelvic floor isn't the only driver of someone's condition.